Welcome back. Does low iodine cause thyroid disease? Hi, I'm Dr. 𝐤𝐤𝐤𝐤. I am the internal medicine doctor here at Angelic Wellness. So I want to talk to you today about low iodine, and it is something that we have not really been talking about in the US as much since the intervention of iodized salt. And iodized salt was introduced decades and decades ago because when we found the prevalence of thyroid disease in the entire world population, we saw that it was way too high to ignore. And one of the very, very common causes of thyroid disease is in areas of the world where people's population live in iodine depleted regions. So, in fact, it was about a third of the world lives in places where there's not enough iodine in their soil to be able to get that nutrient. And we know low thyroid causes a lot of metabolic problems. I mean, we've talked about that on this channel. I mean, thyroid dysfunction can affect over 200 things in your body. And we find that also for babies, when they're born with low thyroid function, they can actually have intellectual disability. So this became a very, very important world problem, and it had to be fixed. And one of the ways it was fixed was by putting iodine on something that the world knows all of us consume on a daily basis, and that is salt. So we took our salt and we added iodine to it and then shipped that all over the world so that every nation now has access to iodine salt. And that is what we call the table salt, right? That most of you have seen or use. And iodized salt really did help the prevalence of thyroid disease because in those regions where it used to be way, way higher, it actually improved. And so iodized salt or table salt made its way into our homes because of that. But what we're doing now is that a lot of us have learned, like, well, there are some healthier salts, right? Things like Celtic salt or sea salt. And for that reason, a lot of us are moving away from using table salt and moving on to these new salts. So it is something to be mindful of, especially in the areas of the world where iodine is still very deficient, that if everybody now goes away from using iodized salt, that we might start seeing increase in prevalence of thyroid conditions again. Something like Celtic salt has plenty of minerals in it. It's not just sodium chloride, it has what we say up to 80 other ingredients. So that might be a good option if that's what you're switching to, but most patients are not switching to Celtic salt. So I just wanted to make sure you are aware that that is an important thing to bear in mind. Especially if your diet doesn't include any type of seaweed or kelp, or seafood that might be giving you iodine from other sources. So low functioning thyroid can be caused because of low iodine. So we definitely want to make sure that that is something that we are not inducing in ourselves by the changes that we're making in our diet of late, okay? So it is also very important to know that, as iodized salt is being used, and we know that it is not necessarily the best salt, we still want to make sure that if we're taking that out of our diet, that we are paying attention to now how much iodine we are getting. And whatever sources that we're replacing iodine with, we also don't want to overdo that, because we can also find things go in the other direction where we've now used way too much iodine and we're now causing what we call a goiter. Right? A goiter is a reaction that happens when the thyroid is now seeing way too much iodine, and then it overreacts or it grows excessively because of this stimulation. So as we're replacing different things in our diet in this era of like trying to be healthier, we also have to make sure that we are not overdoing anything. So again, iodine levels can be checked. It can be checked in the urine, it can be checked in the blood work. These are things that if you know your diet includes things that are high in this, iodine that you might want to check routinely to make sure that you are not doing too much or too little. I hope has been helpful. We know iodine can be used to treat other conditions in the body. In fact, there are some studies showing that iodine can also help prevent breast cysts, ovarian cysts, and so on. So we definitely want to have iodine in our eating plan, but we don't want to overdo anything, okay? So let's talk about how to make sure that we are meeting all the daily requirements and not overdoing our supplements and minerals. I'll see you on the next.